Have you ever felt surrounded by people, but in reality, you still felt like you were completely alone? Where you're not imagining things. Loneliness is not just an emotion, it's a health crisis. In fact, the United States Surgeon General called it an epidemic. And I'll tell you why. I'm going to tell you what it's doing to your body and how we can begin to heal through connections, right? So let's talk a little bit about loneliness. Loneliness is not the same thing as actually being alone. You could be in a crowded house, a busy office, even around friends, and still feel unseen, unheard, and disconnected. That is not a good feeling. Loneliness is the subjective feeling that your social needs aren't being met. And it really requires that you go inside yourself and just think. In 2023, over 1 in 2 U.S. adults reported feeling lonely. That includes working professionals, caregivers, parents, and even healthcare workers like myself. This is a huge issue, and it's having a huge impact on Americans' health. When you think about chronic loneliness, it increases your risk of heart disease, stroke, dementia, depression, and anxiety. So when I say that connection is a part of life, you really have to understand that there's power in connection. Chronic loneliness actually raises your risk of premature death. Yeah, I'm not sure if you knew it or not, but the other things is that, loneliness can trigger stress hormones like cortisol. And over time, with these constantly being triggered, it leads to inflammation, poor immune function, and chronic disease. So as a family medicine physician, I've seen people who have had some normal labs and they look normal, but what's hurting them isn't a test result. It's just being alone in isolation. And anybody can feel lonely, but there are some groups that are especially vulnerable. I'm talking about new moms, remote workers, older adults, and Black and brown communities who may already feel unseen in the United States healthcare system already. Talking about high achieving women who carry everything but rarely get poured into. All familiar story. And here's the worst part. Sometimes people who are lonely even feel shame about being lonely, like it's their fault. And really, it's not. So you have to think about what you can actually do. Here's what I recommend as a physician and as someone who's had to check in with my own self. Whatever you're feeling, say it. Put a name on it. Say it out loud. If you're feeling disconnected, say, I feel disconnected. Naming it is one of the first steps to healing. And then you have to think about the different types of connections that you could actually nourish. We're talking about intimate connections, someone who sees you emotionally, relational connections like friends, coworkers, and people you vibe with. Don't forget about the collective. I'm talking about communities, churches, book clubs, support groups. Like, this is something that you actually need to put on your calendar, like you schedule your workouts or your meetings. Even 15-minute calls or coffee chats actually matter. And try to ask different questions, like, real questions, like, how's your heart doing? How you been feeling lately, really? We as human beings are wired for connection. Sometimes people get away from that in this current age, but the loneliness epidemic is real, and we've got to get back to connecting to one another. And just understand, you are not a burden. You are not alone. The healing starts when we choose to show up for ourselves and each other. So if this resonated with you, make sure you share the video with someone who might need it. And let's start rebuilding our village. Bring our villages closer. And just understand that we're all in this together. It's Dr. Erica R. Jones, MD. Make sure if you have not already that you are subscribed to my channel and that you like this video. Comment down below on your thoughts. And if you even knew that chronic loneliness was a thing.